Is there anything I can do for the bags under my eyes before October? I am getting married in October. I have had bags under my eyes for as long as I can remember, but in the past 2 years they have gotten significantly worse. I was wondering if there was anything I could do for them that will not show in the wedding pictures in October. Of note is that I may have an undiagnosed autoimmune, autoinflammatory, or connective tissue disorder. My skin is paper thin, and I sometimes am prone to hypertrophic keloid scars. Thank you for any ideas or help.
Thank you for your question. You submitted two photos, one with your face relaxed and one with you smiling. And you're asking a question about the under eye bags, and you want to time this before October, which is a few months from now, regarding your wedding, and that you also describe that you have a possible diagnosis of a autoimmune inflammatory type of disease, which you state is actually associated to a degree with your skin being paper thin and a propensity to form thickened scars. So certainly as a practicing cosmetic surgeon specializing in oculofacial plastic surgery for over 20 years, the wedding deadline is something I am absolutely no stranger to. I often tell my patients about a woman who we operated on years ago, who I did her upper lids, lower eyelids, face and neck lift 10 days before her son's wedding. And fortunately things worked out, but that was a lot of anxiety, and I wouldn't encourage that type of timing. I would say that for the puffiness under your eyes, that you have what's called lower eyelid fat prolapse. Let's begin with defining the problem. Now, having lower eyelid fat prolapse means that you have a hernia, a fat that's normally around the eyes, pushing forward and creating these bulges. Now, the good news is that you don't have to have surgery where you would have to have an incision on the outside. This is a very important point. For years, a lot of people of different ethnic backgrounds, of darker skin, were having external incision surgery where where the surgeon would make the approach to the lower eyelid through a transcutaneous approach, which means going from typically an incision under the eyelashes, getting to the fat pockets, removing skin, and then closing. What can happen are a variety of issues, but just seeing a scar that's obvious is very undesirable. For many of those patients, I've actually, I wrote an article years ago called Ethnic Considerations in Eyelid Surgery, and it was clear that for people who have issues with their skin, in my hands and in my practice, I always recommend an approach called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty means we're working from the inside of the eyelid. And so even if somebody is a keloid former, or if they have a type of autoimmune disease or collagen vascular disease, we're able to minimize the trauma by working from the inside of the eyelid. Now, by doing that, we are able to address the fat pockets and avoid making an incision on the outside. So to answer your question from that perspective, you don't have to really be worried, because when we work from the inside, it's almost, it's infinitesimal, the possibility of having some type of scarring issue. And therefore it is pretty, in my hands, a very safe approach, a very predictable approach. As far as timing for the wedding, I like for patients to take as many months as they possibly can before their wedding to do a procedure like this. The earlier, the better. Can we do this in as short as a couple of weeks from the wedding? Yes, it's possible, but there's always a possibility that you can have some fluid and some swelling, and sometimes it has nothing to do directly from the surgery, but maybe concurrently occurring allergies, sinus issues, and other things that can cause fluid to collect around the eyes. So the sooner you do the procedure, the longer time you have before this deadline. So I think that given that October is only a few months away, you should be able to be fine for your wedding and look good for your pictures. I always tell patients who are in a similar situation that since they're going to if for women they're going to be wearing makeup and they'll probably look fine anyway, as long as they're good about following postoperative instructions and managing sinus and allergy issues, if appropriate or if necessary. So I think it's very important you find and meet with experienced and qualified cosmetic surgeons who specialize in eyelid surgery. I think there is a value to super specialists who do this type of work. That's always in medicine, that you always want to find people who do a lot of certain things, but that's again a personal bias as a specialist. But I think that once you meet with someone you're comfortable with, you review their before and after pictures, you feel good about their style and the way they do surgery, then move forward. Another thing I should have also mentioned is recovery time can also be facilitated. In our practice, we do these procedures under local anesthesia with light sedation. This way we avoid general anesthesia, which adds another variable in terms of recovery. People tend to take longer to recover from general anesthesia, and there's higher risk involved with general anesthesia. So in our practice, where we have patients who come from around the world and have patients who have hard deadlines and are always in some type of urgent situation where they need this type of surgery done sooner rather than later, these types of steps, such as in-office, local anesthesia, light sedation, in a facility that's certified by the Joint Commission, so safety standards are always kept to the highest level. Patients are able to recover quickly and are able to move on with their lives and think of more important things. So I hope that was helpful. I wish you the best of luck. Congratulations on your wedding, and thank you for your question.